Richard, thanks for joining me this afternoon. It's been described there as a crisis. Is that your understanding as well?
Good afternoon, and thanks for having me on your show today. The time's pretty tough in rural New South Wales, and we're seeing a lot of pressure on our health workforce, our health services, but they're very, very strong people and very resilient. And one of the things that we like to celebrate, as we saw in your story just then, there's a real joy for those that do work for rural communities, but we do have to accept the challenges are real and be very pragmatic in trying to support a stronger system to help our rural communities.
Absolutely. It's certainly a very resilient community. What's been the impact of the pandemic and now the vaccine rollout on general practice?
Well, we've got great concerns about the sustainability and viability of rural health services just generally. A lot of attention at the moment is obviously going to COVID, but the reality is our health workforce, our health workers are on the back of 3 to 4 years of incredible stress and strain. You think of drought, you think of bushfire, you think of a bit of flood, throw in the mice and now COVID, and we're seeing groups and teams of people that are stretched to their absolute limit. They're very strong and they're trying, but we know when we come through this period with COVID, we're going to need to go into probably a period of 2 to 3 years of paying attention to retaining those that are there, giving them the chance to have a break and take respite and to recover so that they can be fully charged for the years ahead.
Speaking to those on the ground, they were telling me that there's been a real lack of interest in GPs in regional areas in recent years. Why has it been so difficult to attract doctors to the regions?
There's definitely a challenge to recruit general practitioners to rural and remote Australia. It's not just a New South Wales issue, it's actually a national issue. There's a huge amount of work going on by the government, state government and federal government as well. But it's very important also to acknowledge that the challenges that our country faces are being faced by countries all over the world when it comes to remote and rural practice. I think Australia has probably one of the better health services supporting rural and remote communities. We've got an incredibly large country, many, many remote communities. The example you just showed in your story was a township of 100 people. So we need to be thinking about not just around having bodies on seats in our rural communities, but also the types of services that we provide. Our particular focus as the Rural Doctors Network is actually around access. How do we create access to the highest quality of care possible? We think that if we can do that, we always want to have face-to-face services, people living in community and supporting community, whether they're doctors, nurses or allied health workers. But in today's world with different service models, we can create access by different approaches. But at the end of the day, we need to make sure there are doctors coming through the pipelines into remote and rural communities. And that remains a huge focus for all of us across the country.
Tell us about the work of fly-in, fly-out doctors and nurses at the moment who are working in these small towns with a population of about 100 to administer as many vaccinations as possible.
Well, we see the conversation about fly-in, fly-out or drive-in, drive-out as one of the really important pieces of thinking for remote and rural health services. The reality is that we all want to see more doctors and nurses, allied health workers living in community. However, we also have to celebrate those that are able to create space in their busy schedules, be they from the major cities or in other parts of rural communities, that can actually come in and come out of different rural communities. There's often a saying that, get us a doctor. We could take many phone calls about how do we get a doctor. But the reality is the age of one town, one doctor for 40 years, that's gone. And what we look to now is support people through a meandering stream of life and career to give them access to a whole host of different experiences, be it in remote communities or rural communities, regional communities, and even those coming in and out of metro. What we're looking for is people who make a commitment to rural, and we support them through the whole of their career, not just expect them to stay in one town for the whole of their life. And so I think these are the conversations that we're seeing a lot of positivity come from. That the way of working, the way of life these days is different from the past, and we can create really inspiring and professionally successful careers for people, and they can meander through different parts of the service throughout their career. But what we're looking for is people that make that commitment to life for rural.
Absolutely, and of course supporting these very important local communities. Richard Colbran, thank you for joining me this afternoon.
Thank you.